The views and opinions expressed on this program do not necessarily reflect or represent the views and opinions of 580 WCHS or West Virginia Radio Corporation.
And a very pleasant good morning to you. You're listening to this WCHS, the voice of Charleston. I'm Badawi. Thank you so much for tuning in on this Wednesday morning. Nice morning outside. On the way driving into work this morning. Clear roads. A little bit cold. It's colder than I thought. I probably could have used a hat, to be honest with you. Once I got outside, I noticed that it was a little chillier than what I expected. But that's okay. You don't have to worry about scraping your windshields. It's pretty dry outside, just a little bit cold. So welcome in this morning, and thank you so much for your time and listening to 580 WCHS, the voice of Charleston. This is Ask the Expert, and thank you so much once again for tuning in this morning. I'd like to bring into the studio right now, we have online with us from WVU Physicians of Charleston is Dr. Mohamad Badawi and Dr. Ashley Meyer. Dr. Badawi, good morning. How are you doing this morning?
Good morning. How are you?
I'm doing very well. Thank you for your time and coming in this morning and for sharing some of your expertise. We have a very important topic that we're going to get across this morning. Dr. Meyer, thank you as well for coming in. We appreciate it.
Thank you for having us.
Absolutely. First of all, I'll give you an opportunity to kind of introduce yourself just a little bit. Dr. Meyer, I'll start with you. We're going to be talking about the childhood cancers this morning. And, of course, that is it's just a terrible thing that rips through our communities, not only in West Virginia, throughout the United States. Some of these numbers are pretty stark. I've looked into them before. We do some stuff with St. Jude's Research Hospital, and so some of these numbers I'm kind of familiar with. But introduce yourself a little bit. We'll start talking about childhood cancers in just a moment.
Okay. So I'm Ashley Meyer. I'm originally from upstate New York, and I'm happy to be in Charleston now, and I've been here for about 2.5 years.
So you've been in Charleston for 2.5 years, and
Yep.
And what was your passion for leading you to cancers and to help children out? What kind of led you down that path? Anything in particular?
No one particular thing. I think it's just it's a topic that I've been interested in, kind of all going throughout my training. I like that there's a lot of research going forward, and that it's a disease that has changed a lot since the 1970s, and we're having a lot better outcomes. And I'm happy to do my part to help those kids out.
Well, it's something that we certainly appreciate. Thank you so much for what you do for this community, because I know that it can be ravaged by childhood cancers. Dr. Badawi, take a moment to introduce yourself just a little bit of your background and how long you've been in Charleston.
So I'm Mohamad Badawi. I'm originally from Syria. I did my medical school in Egypt, and actually I did my pediatric training here in Charleston. So I was here between 2011 and 2014. Then I went to New York for my training in pediatric cancer and benign blood disorders. And then for 3 years also, and I'm back here in Charleston for the past year and a half.
So let's talk about some of the break down just a little bit some of the issues when it comes to childhood cancers. Whatever the most recent numbers are, let's talk about nationwide exactly what we're looking at as far as what percentage of children suffer from childhood cancers. I know that it's one of the leading causes of death to minors. Let's get into those numbers just a little bit so we can set that up.
That's totally correct. So childhood cancer is still one of the leading causes of death in pediatric population. However, it's still a rare disease, right? There's around 15,000 cases per year diagnosed in the United States with to be honest, the mortality rate, so the number of we lost is around like 20% of that number. But when we compare it to adult cancer, we're still a small fraction of the total cancer cases in the United States. So 15,000 for pediatric per year compared to 250,000 breast cancer that happens in more adult population. So
that's really kind of stark when you think about some of the exactly what goes on. When you talk about the admission into your program, as far as commonality of types of cancers that you see with patients here in West Virginia, what are the things that you're most often seeing introduced into the program?
So
there's a lot of different kind of types of childhood cancer, but the most common are the leukemias. So we see a lot of childhood leukemias. Brain cancer and other central nervous system cancers. And then there's kind of solid tumors like little lymphomas. So those are probably the most common ones that we see in our program.
as far as, I guess, breaking it down into like over decades or over, I don't know what we would consider epochs when it comes to like to cancer studies and to cancer treatments, but we've seen survival rates increase. And if you look at each 10-year block or each 20-year block or whatever it might be, go back 10 years, go back 20 years, go back 30 years, our survival rates are getting better.
That's correct.
Could you maybe talk a little bit about some of the treatments that have been introduced? Is it early diagnosis? Is it better treatments? What is it that we're doing that's actually making this a little bit more compatible?
So it's a combination of all of that, right? So basically, cancer has been described and really old in history. But the treatment for cancer has been mainly surgery in the past, just to take the mass out. Radiation came along maybe 100 years ago, but chemotherapy has been there since the maybe 1970 when they really started to use the chemotherapy. It has been introduced in 1950s, but we have successful treatment with chemotherapy in 1970, and since then we have been adding more combination of chemotherapy, and now we are going more toward more targeted therapies to target cancer specifically, rather than giving chemotherapy that will affect the cancer cells, but at the same time it may affect other cells in the body and cause toxicity and bad side effects.
Some of what I understand with the technology is, like you said, you can now focus in on particular areas, whether using, I think there's some sort of is it like chemo laser almost or something along those lines? I mean, I'm a complete lay person, so I don't really understand some of the technology behind it, but the targeted amount that you could do really does help because it keeps you from hurting the healthy tissue that's around the cancer and let you isolate just the cancer that you're working on.
Yeah, it's pretty cool. So as far as lasering, so there's different ways of radiation now that we can kind of narrow in on just the tissue that you want, and you have less of the healthy tissue that's being affected. But also in our different targeted therapies, so now with science and researchers, we've been able to find certain markers on some of our different cancer therapies and find medications that specifically go to that marker to try to avoid the side effects in the healthy tissues that are being used. So it's a really awesome time, a lot of new technologies, and we're seeing, I think that's going to just continue to improve our overall outcomes.
That's really incredible. Is there anything that you've seen, and I know that you probably are, with the continuing education, different things that are happening, you probably see a lot of things that are kind of down the line a little bit, maybe in the next 5 years or 10 years or whatever it might be that maybe has you excited. Is there anything that you've seen, either some mock-ups on or some early studies on that you're kind of excited about as far as treatment goes?
It's hard to tell a bit about all cancers because, I mean, each specific type of cancer has its own mode of therapy, right? So definitely there are some advances, for example, in leukemias, but it's not something they can generalize for every single cancer, right? So, but definitely targeted therapy is where we're going, and definitely now that we are understanding the genetics of these cancer cells more, they'll be able to make better drugs to fight this disease.
I find that to be, because of the different varieties, and there's not just one pill or one treatment or one diagnosis that can solve all the problems. It's such a complex issue. How about you, Dr. Meyer? Anything that you've seen that's coming down that you're really excited about?
Yeah, I would agree that it's really difficult. Some people think, when's there going to be a magic pill,
Right.
and kind of get rid of everything. And because they're so different, and the way that different cancers act are just so different, there's not going to be a one magic pill. But some exciting things I think Dr. Badawi touched on with leukemia specifically is this CAR T-cell therapy, where we're actually training your immune system to target the cancer cells. And right now it's not the front line for leukemia. It's more for kids that have unfortunately relapsed and so didn't respond to first-line chemotherapy. But I think things like that and using your own immune system to target cancer cells in the future will be more common, and that's exciting.
Yeah, that's definitely exciting when you think about where we've come from and where we are. I have to ask your opinion as doctors, as somebody that definitely have no medical background, but I try to keep up on when you hear stories that break and things along those lines, and try to keep a skeptical eye towards those things every once in a while. It has to be frustrating. I think just last week or maybe the week before, there was Israeli scientists that suddenly discovered a magic cure for cancer, and suddenly it's going to set the world. And then it wasn't until, and this is what always happens, unfortunately, with
lay people covering medical breakthroughs is that it makes the headlines everywhere. Everybody's like, oh my goodness, cancer is almost cured. And then it's 2 or 3 days later that the real scientific community comes out and says, not so fast. Let's talk about what this really means. Unfortunately, people don't get the rebuttal as often, but that has to be kind of frustrating because you're dealing with children. I mean, you almost wonder, and I've been to the St. Jude Research Hospital down in Memphis. I've seen some of what the patients there go through. And when you see a child that's suffering from childhood cancer, you almost wonder why anything else is being worked on. Like, why is there research being done on anything else at all? Why isn't this the one thing that we're trying to cure? So you have parents that come in that I'm sure are very desperate, that want to hear about a magic pill or a magic treatment that's going to solve. You have to deal with that on some level, right? You have to educate the parents on that. No, that's not something, even if it was something that was discovered yesterday, it's going to be years before there's a practical implementation of it. Is that a little difficult of a conversation to have?
Yeah, it is. And it is hard in pediatrics in general, not just in pediatric cancer, but a lot of research in all the different disease subspecialties generally has to trickle down from adults first. So it takes a little while to get to the children. And so that's hard. But I think just being open and honest with our patients and explaining, yes, that'd be great. And, if someday some scientist does find a magic pill, we'd be happy to give it to you. But right now, that's not really reality. And but all those researchers that are working on it, keep going.
Yeah, exactly. And the research is where, obviously, all of these, if there is an eventual cure or very effective treatment, that's where it's going to come from, obviously, is investing into the research. I want to talk a little bit about the patients out there and maybe who it is that you'll see, who you encourage to enroll into the program. If it's something that there's choice available, is there parents with children out there who are looking for a place to take their child who has childhood cancers? How would you kind of explain that ecosystem a little bit, and how would a parent look into getting their children under your care?
So all the hospitals who treat cancer in the United States are almost all hospitals under the umbrella of what we call the Children Oncology Group. Just because the cancer is a rare disease, right? So we have to work all together in research and in treatment to be able to deliver the best care for these patients everywhere in the United States. So we are here in Charleston, definitely a part of the Children Oncology Group. And the treatment that we provide are per the protocols of Children Oncology Group. We do see all kind of cancers. There are some are a little bit more tricky and need very specialized therapy that we might not have in the state, but in general, we do see all patients, and we deliver care for all kind of cancer for pediatric between the age of 0 to 18.
And go ahead, Dr. Meyer. I'm sorry.
I agree. We're part of the Children's Oncology Group, and I said you were asking about how would someone get under our
Exactly.
care.
Yes.
So there is a telephone number that I think you're going to release that people can call. But also, I would say if you're worried about your child and you think that your child has cancer or something wrong, go to your pediatrician or your family doctor, and talk to them about it. So hopefully everybody's going to their well child checks and taking their children to their pediatricians, and then your pediatrician and your family doctor will have a good baseline and know when your child's in normal health and can help pick up on kind of those signs and symptoms and know when the concerning things are happening. And we have a good relationship with a lot of the practitioners out in the community. A lot of them have our cell phones, and if there's something concerning, they'll call us and we'll get you in.
It's very interesting, and I wanted to circle back just a moment to what you said there, because in any of these medical related shows that I do for Ask the Expert, the one thing that is always top line basically is early detection. Go to your doctor, normal checkups and everything else. And with childhood cancers, that's just as important as with anything else. If you have your child coming in to have the regular checkups, if there's symptoms that start to present themselves, that's the first line of defense is your pediatrician, right?
Absolutely.
Correct.
And so, in getting early detection and when symptoms start to come up, is there anything? I mean, there's so many different types of cancers. It's just so hard to say, well, what do you look for? But generally speaking, are you going to see a child that presents symptoms that are overt that a parent might be able to see, or is it really going to be something that you're going to rely on your pediatrician to look for?
It's a mixed bag.
Yeah.
Sometimes there's things that the parents just really know there's something wrong. A lot of times with our leukemias, there's some signs and symptoms the parents can pick up on. But then we have had some great pediatrician pickups on things that the kids were not having any symptoms, and the pediatrician found a mass and sent them to us.
Yeah, see, that's the thing that's so difficult in talking about this. And Dr. Badawi, I'll ask you this question: when you have parents that are looking out for their children, and you're trying to do kind of this early detection thing. There's so many. Symptoms manifest themselves differently with children than they do with adults. I mean, you might expect for an adult, they're not eating, they're losing weight. There are certain signs that we're used to seeing with our older generations, our older populations. You're like, maybe they're not well. With children, it's a lot more difficult to tell those types of things.
Absolutely. And the nature of the disease itself, so the cancer, it's very tricky to detect, actually. So these masses, they may grow in the body for a lot of days, actually, and months sometimes, without leaving any symptoms. And so it's pretty hard to even diagnose this disease or to find it early, right? So it's basically, again, the doctor who is going to ask the appropriate questions and do the physical exam to be able to detect it at home, unless if there's a mass that the parents can feel, or if when the disease is really advanced, then when we have a little bit more symptoms, unfortunately.
You're listening to Ask the Expert this morning, WCHS, the voice of Charleston. I'm Dale Cooper. Thank you so much for tuning in this morning. Dr. Mohamad Badawi is here, and also Dr. Ashley Meyer from the WVU Physicians of Charleston, the pediatric specialist. We're talking about childhood cancers this morning, located, of course, at the CAMC Women's and Children's Medical Office Building, 830 Pennsylvania Avenue. Phone number is 304-388-1552. You can call us this morning, but be sure to write down this number, because if you have any follow-up questions, anything specific, and certainly any illness that you're concerned about, that you want to ask follow-up questions, you want to have this number, 304-388-1552, 388-1552. If you do have any questions this morning that we might be able to answer on the radio, you're welcome to give us a call. Our number is 304-345-5858, 304-345-5858. I know medical situations, like when we talk about financial situations and other things on the radio, are a little personal. If you want to just give your name as John or Jane, you're more than welcome to do that when you call in, just so you can ask your question and feel like you're maintaining your privacy, because some of this stuff can be a little bit, sharing personal information publicly can be a little bit difficult. So I understand that. You're welcome to do that if you want to give us a call this morning, 304-345-5858, 304-345-5858. If you have a loved one that may be affected by childhood cancers, or maybe a child of your own, a grandchild, a friend, anything where you might feel like you need a little bit of advice and steering into the right course, you can give us a call this morning. Once again, that number is 304-345-5858, 345-5858. So what I want to do now is I want to go ahead and take a commercial break. When we come back, I want to kind of walk through so we're dealing with so many different types of cancers. It's kind of hard to specifically single out any one treatment or anything. But let's talk about just in general, if someone is suffering from a childhood cancer, the experience that they would have in coming to see you and to get treatment there. Because I know a lot of times what parents worry about is exactly not only the treatment that their kids are going to get, but like the socialization as they're experiencing their treatment and things along those lines. So we'll talk a little bit about that when we come back. You're listening this morning to Ask the Expert. My guests in studio, Dr. Ashley Meyer and Dr. Mohamad Badawi from the WVU Physicians of Charleston, the pediatric specialist. We'll take a break and be back right after this. You're listening to 580 WCHS, the voice of Charleston. I'm Dale Cooper. We'll be back in just a moment.
Is the Charleston program, I know you're a full member of the oncology group. At one time, this was the only program in the state that was a
Not
full
anymore.
member. I think Morgantown.
At First Energy, we're putting more into tomorrow so you can get the most out of today by investing in a smarter, stronger, safer grid and innovative technology that improves reliability. But most of all, we're investing in our people, the dedicated men and women who work each and every day to bring you a brighter future where energy is smarter and living is better. See their stories and more at firstenergycorp.com.
Buy the Reds Pick 6 plan presented by McDonald's and receive an exclusive oversized Joey Votto bobblehead. You can pick any 6 games, including Fireworks Fridays and Bobblehead Saturdays, while saving up to 25%. Plus, you get 6 McDonald's Extra Value Meal vouchers. Be a part of the historic 150th season by purchasing the Reds Pick 6 plan. Get yours today at reds.com/tickets. Some restrictions apply.
Good morning, I'm Mayor Kane with your traffic update. No accidents to pass along at this time. Good news there. We are seeing some high winds throughout the region this morning. That has knocked down some trees throughout the area. Use some extra caution as you do make your way into town. Traffic looks to be flowing well on all 3 major interstates coming into downtown Charleston, but be prepared for some normal congestion when you get close to downtown. particularly on 64 eastbound between the Montrose and Oakwood exits. This update is brought to you by City National Bank with 86 convenient locations to serve your banking needs. City National Bank, member FDIC, equal housing lender. For a convenient location near you, log on to bank@citi.com. I'm Eric Kane with your traffic report.
You're listening to Ask the Expert, WCHS, the voice of Charleston. Thank you so much for tuning in on this Wednesday morning. I'm Del Cooper. In studio with me this morning, Dr. Mohamad Badawi and Dr. Ashley Meyer. They're from the WVU Physicians of Charleston, pediatric specialists. We're talking about childhood cancers this morning. You can find out more information online, WVUPC.org. That's WVUPC.org. The phone number is 304-388-1552, 304-388-1552. You can call us this morning, 304-345-5858, 345-5858. Dr. Badawi, one thing that I wanted to make sure that folks understand when we're talking about treatment of childhood cancers and things along those lines, with having specialists here and with the team that you and Dr. Meyer have together, some of that in the past where you'd have to travel out of state, you'd have to go to different cities, you're looking for the bigger hospitals, whatever it might be, that's not necessary anymore. We can do all of that right here in Charleston.
Absolutely. We definitely can do all that in Charleston. I mean, we can deliver the exactly same care that any other institution can. We are also a big team. It's not the doctors only. We have the doctors and the nurses and nurse practitioners. We have a dietitian in our team that take care of the child diet and feeding, and also we have a psychologist, a social worker that helps the whole family, because sometimes you have to drive from, even in West Virginia, you have to drive a long distance to come here, so it helps with a lot of stuff. In our also in our group, we have a very good relationship with other subspecialties once we need them. So if we need anyone from endocrinology to help with the growth and stuff like that, we always have a very good connection with them. And even if we need to do anything, again, one more time, out of state, which rarely we do, we also have a very good connections with the hospitals around to, and we will all work together to get the specific therapy, for example, out of states, but then they will come back to continue and to follow up after treatment.
I find that to be very good, and in this area, very useful. There's some areas in rural West Virginia, especially if we're talking about our part of the state here in Charleston, once you go south or southwest or something like that, really there's not a good, I mean, Charleston is the most convenient place for them to be able to come to, and if there wasn't an answer here for them to deal with childhood cancers, I mean, the drive could be quite long, and that is stress on the family in itself, because you have to either fly or drive, and that's time that you're taking, and not to mention the expenses. I mean, it's really difficult to do that. Being able to stay in state, even if it means driving 90 minutes or a couple hours north or something like that to get to Charleston, that's a lot better than having to drive 6-7 hours or fly on a plane or taking your sick child in a car for 6 hours to drive somewhere. I mean, that's really very dangerous. And in West Virginia, I mean, you're never more than 2.5 or 3 hours from Charleston, regardless of where you are. So, I mean, it's a centralized location for things like that. And I'm sure even to some degree from out of state, folks find Charleston to be an easier place to come to.
It's pretty long, actually. I mean, something very important to mention,
Good
because,
point.
I mean, maybe the shortest is 6 months and the longest can go to 3.5 years.
Right.
So to drive to out of states for 3.5 years will become very hard over time and very cumbersome for a family.
I could imagine. My wife and I were completely healthy, but we were driving out of state for fertility treatments at one time, and so it was something that we had to do. A couple times a month. We were driving to North Carolina. It was happy moments for us. I mean, after a long journey, but we felt good about it. So we were in good moods where we were going. There wasn't anything, I mean, so there wasn't really anything like a childhood cancer that made it that much of a downer, but it was still, I mean, it was a lot of work to have to take the time off work, to get down there to have the procedures done. I mean, the travel expenses, staying overnight from time to time. I mean, it adds up on top of everything else that you're doing. So it's really important to keep those things here locally. And Dr. Meyer, I thought I might ask you for just a moment, talking about, I mean, when we're dealing with children specifically who are dealing with the diseases, and it's so to see how sickly, and I mean, I've seen some of these children that have recovered, or even ones that had life prolonged for some amount of time before finally succumbing or whatever it might be. It's very, I mean, it's just very sad. I mean, when and it's also very heartening when you see somebody that overcomes that. But dealing with that on a local basis, you have a whole team together that can do that. So it's very important for the child, once they're introduced into your program, they're going to be treated appropriately through the entire time. The relationship with the doctors and with the parents and the staff and everything is going to be something that, as much as you can make it an experience that they're not going to hate, that's what you're trying to do.
Absolutely. And as sad as it is to say, some of these kids coming into our infusion center and, they get to know our nurses and our nurse practitioner and our team so well, it becomes kind of part of their routine. And they come in and they give us hugs and, how are you doing today? And show us their newest, toy or shoes, and it just becomes not quite as scary once they, get to know the team and work together. And, when they are spending those long days in our infusion center, sometimes that can be tough. We have a child life specialist to try and help with that too.
When you talk about the infusion center, what types of treatments are done there?
So we do a lot of oncology therapy in the infusion center, not just cancer therapy. But most of the time when our patients need some sort of chemotherapy infusion that does not require them to stay overnight in the hospital, they'll come in and get their therapy there. Also, we do a lot of our lumbar punctures, some different kinds of procedures where we can deliver chemotherapy right into the spine through our infusion center, and we have a great anesthesia team to do that too, so the children are asleep during that part. But a lot of that stuff is right in the infusion center. So
super high-tech, super convenient locations to be able to deliver this type of treatment for your patients, including the children that we're talking about this morning. So you have the different, you have the infusion center where you do treatments, and you talked a little bit about occasional overnight stays, or if it's outpatient or whatever it might be. Typically, and again, it's so hard because there's so many different strains of childhood cancer. But is there a lot of long-term admissions where you would have somebody that's in the hospital for weeks at a time, or is your goal to get them in, treated to a degree, and then out and coming back for treatments? How does that typically work for a patient?
Yes, definitely. I mean, again, it depends on the type of cancer. Yeah. We have, for example, one of a kind of leukemia called AML. This treatment, it's mainly inpatient, mainly inside the hospital. You'll get your chemo, you have to stay because there's a high risk of having infection also right after this chemotherapy that will suppress your immune system. So it has to be monitored in the hospital, receive antibiotic if anything happened, go home for a shorter period of time, and come back, actually, unfortunately, to the hospital for the whole length of treatment, which could be around 6 months. There's not only that type of cancer, the other lymphomas that also you may need to have a prolonged stays in the hospital. And again, the team that we have that will help the family with the whole thing, right? So the patient is going to be in the hospital, but if the family want to stay nearby, and they have access definitely to Ronald McDonald housing, and also they will have food and money and all that. We are like a big team that we can provide all that to the family.
It's interesting you mentioned a nonprofit, a charity organization like the Ronald McDonald House. You hear about Ronald McDonald House all the time, and different fundraisers that it does and things along those lines. But this is actually exactly what it was designed for. Is this type of situation where you have children or family members that are suffering from cancer or something, and a place to stay and to socialize and things along those lines. Do you have resources then for parents where you can direct them in certain locations for social help? I mean, you're giving them the medical help that they can, and as much as possible with dealing with the situation, but parents need support too, not just the children. Do you have resources where you can direct parents when they start bringing their children into you for treatment?
Yeah, our social workers are great, and we also have a lot of different organizations. The Ronald McDonald House is helpful for the patients when they need to stay inpatient, and mom or dad might need a place to go. But there's a lot of different organizations. The West Virginia Cancer Crusaders helps, Kids Cancer Crusader. They are able to help with some of that social help, also sometimes with money or gas cards. We have a lot of those kinds of resources to help with some of the social situations as well.
That's really, that's such a complicated situation when you're talking about parents with children who have cancer and how that affects their whole life, their whole lifestyle. I mean, it probably, I would imagine, and I hope that I never have to find out. I mean, but I imagine it completely takes over your life. That becomes basically how you define how you live day by day. Is you have to plan for the treatment, the visit. You're monitoring your child for continuing symptoms or getting better, and it's probably something that you're always worried about as a parent, and saying, okay, is the treatment working? Is it not working? Can't wait till we get into the next checkup to see where we are with it. I mean, that's a very difficult situation to be in for a parent, and not to mention the kid who really doesn't understand completely what's going on a lot of times. Of course, you have some older childhood cancers as well, but especially when you're talking about the youth. When someone does get enrolled into starts to come see you for treatment, and I mean, like we said, there's so many different cancers that rolling up the stages of treatment can be different for each one of them. But is there, like, I guess once they're walk us through like what a typical steps would be in treatment. Like, say the first week, they come see you for the first time, they come for their initial checkup to get things. What are some of the things that they're going to go through for like their first week before they enter into the program full time?
So the first week is pretty busy, right? I mean, there's a lot of stuff happening in the first week because it's it's definitely a big shock to the family, right? And there's going to be a lot of tests and imaging to diagnose the disease, and also to see the extent of the disease. And also there's going to be multiple procedures, and also so it's a lot of stress, to be honest, in the first week of when they come to see us, just because we are trying to figure out what's really going on, right? And then we'll sit with the family and talk about the design of treatment and how we're going to move on with therapy and how long therapy is going to take and what is the potential side effects that could happen from the therapy. At the same time, we'll work with the family on the social issues, right? Also, the kid himself most likely is going to be out of school for the whole length of treatment. It's not only affecting the parents and the kid, but other kids also in the family may get affected, whether it's going to be emotionally because their brother or sister is having cancer, and now the whole family also, attention is more, that it goes all to the sick child, but they also need someone else to take care of them, right? So we have, as physicians and as a team, we have not only to work on the sick kid, but we have also to help other children in the household. We have to help the parents also to go through that time. It's a long process and has a lot of stuff in it. It's hard to summarize in a few sentences.
Yeah, I know it's so difficult because there's so many different avenues that you have to look down. But I think that really kind of explains it quite well. And again, just going back to something that you said there, and not that we need. I mean, there's never too much compassion, but it just strikes me when you talk about the child's probably not going to be in school because they're receiving treatment. So think of the full-time working parent. Probably the insurance is provided by the parent who works, so they're in a situation where they have to maintain their job to maintain their insurance, but they have a child who has to stay home all the time because they're undergoing treatment. What a tough situation to be in. I mean, and so if you're out there listening and you're obviously not suffering from a childhood cancer or know someone that is, and this is pulling at your heartstrings, find an opportunity to volunteer somewhere, because this is one of those things that every time that I have this conversation, for whatever reason, and I'm a first-time dad now. I'm 45. I have an 8-month-old child at home. So thinking about these things from the perspective of a parent for the first time in my life really gives it an all new perspective, and it makes it all that more emotionally impactful. And so if you're out there and you're listening to this and you're wondering what you can do, there's resources out there where you can help. And I'm sure that you could probably even help direct them to that if they wanted to call. And if somebody just wants to say, hey, where can I volunteer time? What's the best place? They could probably call you to find out some information on that. Yep. So again, we're talking this morning, Dr. Mohamad Badawi is here and Dr. Ashley Meyer from the WVU Physicians of Charleston, pediatric specialist. We're talking about childhood cancers this morning, located over at the CAMC Women's and Children's Medical Office Building at 830 Pennsylvania Avenue. The phone number is 304-388-1552, 304-388-1552. You can find out more information online. It's WVUPC.org. That's WVUPC.org. Just for the last couple minutes of the program, what I'd like to do here is focus as much as possible, either in the abstract or if you have a specific situation that you can think about. We've talked about all of these things that are so impactful to parents and these sad situations. You've seen successes, though. You've seen people that have recovered. Is there one that kind of sticks out? And I'll start with you, Dr. Meyer. Is there one that kind of sticks out in your mind of a success? I don't want to breach any confidentiality, but just in abstracts that you can share.
I wouldn't say one in particular, but it's more, we also, yes, we have the hard job of telling the family that they have cancer and going through the crazy, whirlwind of that. But also we do survivorship clinics, and that's great when we get to see those kids all these years down the line that are successful, doing well, getting into college, having children of their own. So that all of those are really wonderful and kind of keep us moving forward.
That really has to be, rewarding. It's kind of the other end of things after all the hard work that you put in. However often you have these types of clinics and you get to meet with these former patients, even if it's only a few times a year or whatever, just seeing that and seeing that type of success in the future for somebody that you helped treat it. that's got to be rewarding for the right reasons, I imagine. So how about you, Dr. Badawi? Is there any, maybe not particular person, but type of recovery that has really impacted you that you remember?
One per se, I don't know, because in general, yes, the cancer, it's a horrible disease to have, but in general, when we put all cancers together and pediatric cancer together, the cure rate is pretty high. When we put them all together, it's more than 80%, but actually some kind of cancer like low-risk leukemia, you could have a cure rate up to like 97%. Wow. This day and age. So we definitely have a huge improvement in treating these patients, and actually we do see a lot of success stories. Unfortunately, there are going to be some sad stories every now and then, but most of our patients, they usually do great and awesome. You'll be amazed how much these kids are, how strong they are, and how much they are resilient and be able to go through it with barely much problems.
Kids are very resilient, are they? It's pretty amazing when you think about what they go through and then compare to what we go through as adults, and sometimes they handle it better, I think. It seems like. What a powerful message, and what a kind of an uplifting note. We have just a couple minutes left, but to kind of end on, because we started the show kind of talking about success rates and how technology, it seems like every decade-ish or so, seems to really increase those success rates for childhood cancers. But that is something that you're participating in that success. You deploy effective treatment that's helped numerous people, numerous children in the area overcome that. But that has to be also over the course of the time that you've been in this field, just to see that kind of success rate and to know that you're implementing these practices that you've read. Now that we have success rates that's 90+% or 95+%, I'm sure that talking to a parent for a first time that gets diagnosed, your child has this kind of cancer, that's crushing, but then you can follow that up. However, we have this success rate with it. That's a powerful thing, right?
Absolutely. Yeah.
What do you best advice for parents that are just discovering this? I know that you have to come up, and it's got to be difficult. It's got to be really hard. And I don't mean to put you on the spot for it, but when you're talking to parents for the first time, we were talking a moment ago about the first week, and I know myself as a dad, if I was bringing my child in for that, I would be distraught all over the place, probably unable to think clearly. But what's the advice that you give parents, like when you're first talking to them and counseling them?
Take it one day at a time, and ask questions. I tell our parents often when I give them a diagnosis, I say, I know that what I'm going to talk about next, you probably won't remember anything that I say. So write down your questions, ask us. We're going to help you through this. We're going to figure out what it is, and then we'll talk about how we're going to battle it. And don't be afraid to ask questions. Even if you think it's something we've already gone over, just ask us, and take it one day at a time.
Yeah, the one day at a time thing, people might think that it sounds rote, but it's really true. On something like that, because it's hard to think too far in advance, and you have to be in that moment to assimilate the information. And I'm sure you could take notes or do something, or you have plenty of information. I'm sure you hand out, but it's just such a difficult thing. Dr. Badawi, same question to you. Is there any particular path that you try to set parents on?
Basically the same thing, to be honest. Take it one day at a time. This is what we do. It's hard to give answers about what's going to happen in the whole length of treatment. We tend to reassure patients, and if there's anything wrong, not expected happening, we tell them right away. We want them usually to trust us. We are the right connection between, the second we know something, we will tell the family right away. We don't intend, obviously, to hide anything on anybody. We usually work all together and have a great relationship with the family and the rest of the team.
Thank you so much for your time this morning. Once again, the WVU Physicians of Charleston, Pediatric Specialist, 304-388-1552, 388-1552, WVUPC.org. Dr. Badawi, thank you so much for your time this morning. Appreciate it.
Thanks so much.
Dr. Meyer, same thing. Thank you so much for your time. We appreciate that this morning.
Thanks for having us.
Take care. You're listening to WCHS Charleston. Danny Jones is up next.
580 WCHS-AM. AM, 96.5 FM Charleston, and 104.5 FM Cross Lanes, a West Virginia Radio Corporation station. It's 9 o'clock.
From ABC News, I'm Brian Clark. The White House is looking at options after congressional negotiators came up with a border security deal that includes just under $1.4 billion for a wall. ABC's chief White House correspondent Jonathan Karl says
senior White House officials say the president can act on his own to get additional money for the wall, and that he can do so possibly even without declaring a national emergency. One top official said that the White House believes they can get an additional $3 billion shifted from other projects and other programs.
If there's no deal, the government faces another shutdown at the end of the week. Today, President Trump will also discuss the crisis in Venezuela. ABC's Karen Travers has more on that.
Venezuela is the big issue on the agenda today for President Trump's meetings with the president of Colombia. The White House says the two leaders will discuss efforts to restore democracy in Venezuela, as well as to restore democracy in Venezuela, as well as to restore